Today we will be going over the radiographic positioning and techniques for upper body extremities. So for the AP position of the elbow, we will have our patient go ahead and extend their elbow. This is perfect, patient. You want their hand to be in a supinated position, and you want to place a posterior surface against the IR. So you want to do this like this. Okay. Your central ray is going to be centered to the mid elbow joint. Your mid elbow joint should be right around here. Okay. Our exposure is going to be taken at 40 inches SID. Make sure that your patient does not rotate and they stay in a true AP position. Perfect. Place your marker and your exposure is taken. So we will be doing the oblique elbow position. This position is great because it actually visualizes the radial head and the neck. We're going to use a 10 by 12 cassette, which is not visualized here. You want to make sure that the elbow is extended and the hand is going to be pronated. So our patient is doing a great job. You want to make sure that you palpate the epicondyles to check for a 45-degree internal rotation. Okay. So this is pretty similar position as the previous one, except that the hand is supinated and we're rotating the elbow 40 to 45 degree externally. So for some patients, this might be a little bit uncomfortable. Our CR is going to be centered at the mid elbow joint. So what we're going to actually do is patient, I'm going to go ahead and to rotate our patient at a 45-degree angle. Our patient's having difficulty doing so. Some patients may not be as flexible. Make sure you always have your central ray. And then the exposure is taken. We'll be exploring the lateral elbow position. We want to make sure that our patient has their elbow flexed at a 90-degree angle and their shoulder can rest on top of the table if necessary. So I'm going to go ahead and correct here my patient. Make sure that he is an actual 90-degree angle. Come on, patient. Thank you very much. All right. So you want to make sure that the center of the elbow is going to be at the center of the IR. So that would be right around there. And you want to make sure that your patient places their hand and wrist in a true lateral position. Perfect. There you go. You see how he's in a true lateral position right here with a 90-degree angle. The image is going to be taken at 40 inches SID, most likely a 10 by 12 cassette. You want to make sure your CR is centered to the mid-elbow joint, which should be around here. And then the exposure is taken.